Our world is changing with unprecedented velocity. A dramatically aging population and national and global healthcare reform are driving fundamental change in healthcare delivery. The U.S. population over the age of 65 is expected to double by 2060. As this trend continues, seniors who want nothing more than to age in place will seek out increased care for longer spans of time in the place where they want to be the most, their home. In fact, it costs 40 times more to treat a patient in an acute care facility than it does to provide that same care at home. So it's not surprising that insurance companies, employers, and government payers are all welcoming lower-cost alternatives. Home will undoubtedly become the center of healthcare, thanks to medical advances and technological innovations, along with the unparalleled ability to safely and effectively support patients and clients of a wide range of medical and life conditions. The healthcare industry is moving to respond, but only one franchise company offers the full continuum of care. With over a half-century of experience, that company is Interim HealthCare. Over the past 54 years, we've certainly seen our share of change. But perhaps the changes in business regulations have been the most profound.
Seems like every time, particularly when working with the government, you think you figure out the system, it's going to change.
Interim HealthCare has responded to ever-changing business cycles by innovating the way care is delivered in the home.
We were the first people to take a child home on a ventilator to the home.
When I look at it in retrospect and I think here's nurses using tablets, aides using smartphones, it's incredible, but it all fits. Keep our mission and improve lives using technology, but never having it substitute for the care.
Interim HealthCare is a business with a heart, and that heart beats true in every interim caregiver and franchisee.
When you have the number of owners and or their families, which is now in the third generation, that tells you that as a franchisor, you must be doing something very, very right.
The success of our franchisees has led to Interim becoming the #1 franchise in the home healthcare industry. All because we set the standard as first in home care with our proprietary clinical programs. These market differentiating resources enable the ability to support our owners while they become the best local operator, community leader, and employer that they can be.
The franchisor was very helpful getting me going with licensure and the clinical side, the aspect of the Department of Health.
I would never be able to keep up with the compliance changes that are happening in the health industry today.
I wouldn't want to go into this business without that support.
Our business model is not only here to provide support in good times. We have a track record of recession-proof business practices that have led through industry and economic shakeups. The latest, COVID-19, is an example of one of these challenges. Right as the pandemic hit, Interim immediately drove awareness and advocacy for our critically vital medical services. Our CEO, Jennifer Sheets, a career-long healthcare professional, is a registered nurse who has over 25 years of home care experience. With our seasoned clinical and support team, we'll continue to be on the forefront of local, state, and federal guidelines, playing a vital role in the overall healthcare ecosystem, especially in a time of crisis. We provide long-term, sustained financial and business opportunities, preparing franchisees for changing environments. Even now, we're finding new ways of leading through the COVID-19 crisis and maximizing revenue opportunities. All this together makes Interim HealthCare the part of the healthcare market where you can invest with the most confidence. Demand for elder care will also be driven by a steep rise in the number of Americans living with chronic conditions, which could more than double by 2030. The growing senior population also means that Social Security and Medicare expenditures will increase from a combined 8.7% of the gross domestic product to 11.8% by 2050. Interim HealthCare is positioned perfectly to take on the growing needs of our senior population due to our full continuum of care in the local community. From high acuity cases where care can be medically supported at home, all the way through to staffing, Interim stands out as the leader in the marketplace, making us the best choice to invest for impact and sustained growth. Since our beginnings in 1966, the world has changed dramatically. Yet one thing remains the same. Care is more effective when it's delivered in the home. We've developed a large U.S. footprint in 41 states with 330 locations nationwide. Through our parent organization, Caring Brands International, we've helped hundreds of thousands of people throughout the world live with greater safety, independence, and dignity through home care. With our proven expertise, unrivaled systems, and plenty of greenfields still to expand in the U.S., we offer a model that delivers unmatched value for all it serves, payer, referral sources, and regulators alike. there's a bright future for home healthcare. Being a part of it with the global brand leader who is first in home care will no doubt yield limitless possibilities.
Interim is a disruptor. We look for new solutions and new ways to serve. Based on all you have heard today, you know that, pandemic or not, it's possible to not only survive, but to thrive in this environment. In fact, Interim Healthcare has taken on a leadership role in our industry. That creates even more opportunities to raise up our franchise brand and to grow our network.